Hello everybody, my name is Soumen Sengupta. I am the Director of Health and Social Care for South Lanarkshire, and I am delighted to be able to join you here today, albeit through a pre-recorded video message. I've been given a preview of the short breaks clips that you've had the opportunity to see now that were fantastically presented by Sharon and Stephen. Amongst the brilliant work showcased, what really struck home to me were the very personal experiences recounted by Brian, by Linda, and by Rashida. Their compassion shines through. As Brian says, caring for his wife Avril is very much a labour of love. They were also very candid about setting out the pressures, the stresses, the strains of being a carer, which underlines for me the importance of them having an outlet, them having a rest, and them having support. So as we think about the common threads through Brian's story, through Linda's story, through Rashida's story, I hope that speaks to what our common purpose is here today. Simply put, we need to look out for those who do the looking after. And in looking out for them, we need to make sure that we create a context by which they are also able to look after themselves. That's why the short breaks initiatives are so very important. Now, you know that the pandemic has been particularly challenging for carers of all age groups across Lanarkshire. In South Lanarkshire, we are very fortunate to have very strong partnerships, a real tradition of working together. And that's going to be really important as we work through those challenges moving forward together. Now, the CARES Act placed obligations on organisations such as mine, and indeed on senior leaders such as me, to further strengthen, to further bolster those partnerships and the support that's provided. The local carer strategy then is a critical document in enabling that work to go forward. As many of you know then, we have 4 clear goals within that. Firstly, that carers are identified, that they are involved, and that they are valued. Secondly, that carers have choice and control, allowing them to balance their individual lives with their responsibilities as a carer. Thirdly, that carers can access the right services, the right supports at the right time. And fourthly, that carers are able to have a positive experience of being a carer. Now, from my early conversations with Samar, with Barbara, and indeed with the board of Lanarkshire carers, it's clear to me that there's a real passion for delivering upon those shared goals. And indeed, there's a real commitment to working together to deliver for what is a vibrant and diverse carers community. My team and I share that commitment. Now, we aren't out of the pandemic yet. And so we've got a lot of uncertainty, a lot of frustration that we will continue to have to cope with, and we need to support each other with. So before I finish up, I would like to ask you again to make sure that if you've not been vaccinated already, to please do so, to please continue to behave in a COVID sensitive manner, and to thank you and ask you to continue to do what you've been doing so brilliantly, which is to looking after others, and also I hope to let others look after you. I hope you enjoy the rest of your morning. Thank you very much for letting me have some of your time. Take care, and I hope that we can meet together in person sometime soon. Many thanks.